It's 9 p.m. You're sitting on your couch watching television. Your feet feel cold. Ice cold. You reach down to touch them, and they read like blocks of ice, despite wearing 2 pairs of socks and having the heating on full blast. You think it's just winter? Just getting older? Just normal? But here's what most people over 60 don't realize, and what your doctor might not have told you. Cold feet aren't just uncomfortable. They're your body's desperate warning signal that your circulation is collapsing from the inside out. And according to a groundbreaking 2024 study from the Cleveland Clinic involving over 12,000 adults, people over 60 who ignored persistent cold extremities had a 340% higher risk of major cardiovascular events within the next 3 years. That's not a typo. 340%. In my 18 years of clinical experience, there's a pattern I've seen over and over again, especially in adults over 60. When someone comes in saying, "My feet are always cold," it's rarely just about the feet. Cold feet can be a quiet, early signal of something much bigger. A change affecting everything from the heart and brain to the kidneys and even daily energy levels. Today, I'm going to show you the 7 hidden reasons your feet are cold after 60, and more importantly, what each one means for your survival. Because here's something that will shock you. Harvard Medical School researchers discovered that cold extremities in seniors aren't caused by one thing. They're caused by a perfect storm of 7 interconnected failures happening simultaneously in your vascular system. And the most dangerous part, by the time you feel the cold, the damage has already been progressing for years. Before we begin, do me a favor. Drop a comment right now telling me your age and whether you experience cold feet regularly. I read every single comment, and your input helps me create content that addresses your specific concerns. Let's start with the most dangerous cause of cold feet, and the one that's most commonly missed until it's almost too late. Peripheral arterial disease, or PAD, affects an estimated 12 to 20% of people over 60. But here's the shocking part. The American Heart Association estimates that 75% of people who have it don't even know they have it. PAD occurs when atherosclerotic plaques, those fatty calcified deposits, build up inside the arteries that supply your legs and feet. These plaques narrow the vessel opening, reducing blood flow. In the early stages, you might only notice coldness, maybe some fatigue in your legs when you walk. But as the disease progresses, it becomes deadly. Here's how to identify if PAD is causing your cold feet. First, compare the temperature of both feet. PAD often affects one leg more than the other, so one foot will be noticeably colder. Second, check the color. PAD-affected feet often have a pale, almost bluish tint, especially when elevated. Third, examine your toenails and skin. Are your toenails growing slowly? Is the skin on your feet becoming thin, shiny, or hairless? These are signs of chronic oxygen deprivation. The most reliable home test is called the ankle brachial index, but you need a doctor's equipment for accuracy. However, you can do a simple version yourself. Lie down for 5 minutes, then sit up and observe your feet. If they turn deep red or purple within seconds of hanging down, it suggests your vessels are so narrowed that gravity is the only thing forcing blood into your feet. Lifestyle modifications can be as effective as medication in early-stage PAD. The walking itself stimulates the growth of new collateral blood vessels, literally creating new pathways for blood to reach your feet. Now let's talk about something that looks scary but is usually less dangerous than PAD, though still significant. Raynaud's phenomenon causes your blood vessels to spasm and constrict excessively in response to cold or stress, temporarily cutting off blood flow to your fingers and toes. When this happens, your extremities don't just feel cold, they turn white, then blue, then bright red as blood flow returns. The color changes are dramatic and frightening, but here's what you need to understand. Primary Raynaud's, which typically starts earlier in life, is usually benign. Secondary Raynaud's, which often develops after 60, can signal serious underlying conditions. Certain medications also trigger or worsen Raynaud's beta blockers, commonly prescribed for high blood pressure and heart conditions, constrict peripheral blood vessels. So do many migraine medications, and some over-the-counter decongestant. If you started a new medication around the time your cold feet began, that's a crucial clue. Here's something that surprises most people. Your thyroid gland, that small butterfly-shaped organ in your neck, controls your body temperature more than almost any other factor. When thyroid function drops, which happens increasingly after age 60, your entire metabolism slows down. Your cells produce less heat, your circulation becomes sluggish, and your extremities turn ice cold. The symptoms of hypothyroidism extend far beyond cold feet. You'll likely also experience fatigue, unexplained weight gain despite eating normally, constipation, dry skin, hair loss, brain fog, and depression. If you're experiencing 3 or more of these, along with cold feet, demand a complete thyroid panel from your doctor. Treatment is usually straightforward. Thyroid hormone replacement, typically levothyroxine, can restore normal function. But here's a critical detail. It takes 6 to 8 weeks for thyroid medication to reach steady state in your system, and dose adjustments are common. Some people need T3 supplementation in addition to T4. Work with an endocrinologist who understands the nuances of thyroid management in older adults. Before we continue with the 4 remaining causes, including the #1 most overlooked reason your feet are cold, I need you to do something. Hit that like button right now if you're learning something valuable. And subscribe to this channel because we're releasing videos every week that could literally add years to your life. Even if you don't have diagnosed diabetes, unstable blood sugar is one of the most common causes of cold feet after 60. Here's why this matters so much. Chronically elevated blood glucose acts like glass shards flowing through your bloodstream, damaging the delicate endothelial cells lining your vessels. Over time, this damage creates something called diabetic neuropathy, where the nerves in your feet and legs lose function. But before the numbness sets in, there's often a phase of altered sensation where your feet feel cold even when they're warm to the touch. This is sensory nerve dysfunction, and it's a warning that motor nerve and autonomic nerve damage are coming next. The key is aggressive, consistent blood sugar management. This means not just medications if needed, but fundamental dietary changes, eliminating refined carbohydrates and sugars, focusing on protein, healthy fats, and high-fiber vegetables. And crucially, timing your meals to avoid blood sugar spikes. Here's something that catches many people off guard. Your blood needs iron to carry oxygen effectively. Without adequate iron, you can have perfect circulation. Wide open blood vessels, but your tissues still suffocate because your blood simply can't deliver enough oxygen. Anemia becomes increasingly common after 64, several reasons. Reduced stomach acid production makes iron absorption less efficient. Many common medications, particularly proton pump inhibitors for acid reflux, further block iron absorption. Internal bleeding from things like gastritis, ulcers, or even colon polyps slowly drains iron stores. And chronic inflammation from aging itself increases something called hepcidin, a hormone that locks iron away where your body can't use it. If anemia stems from chronic disease or inflammation, treating the underlying condition is crucial. If it's from blood loss, you need to find and address the source. This might mean a colonoscopy to check for colon cancer or polyps, or an endoscopy to examine your stomach and esophagus. This is the cause that makes me angriest, because it's so preventable yet so rarely discussed. Many common medications prescribed to people over 60 directly impair circulation to the extremities, causing cold hands and feet. Yet doctors rarely warn patients about this side effect. Certain blood pressure medications, particularly diuretics, can cause electrolyte imbalances that affect nerve and muscle function in your extremities. Others, like calcium channel blockers, can paradoxically cause peripheral edema, swelling that compresses small blood vessels and reduces circulation. Even seemingly unrelated medications can contribute. Many antidepressants, antihistamines, and decongestants have anticholinergic effects that impair blood vessel regulation. Birth control pills and hormone replacement therapy increase clotting risk, potentially contributing to small vessel blockages. Here's what you need to do. Make a complete list of every medication and supplement you take, including over-the-counter products. Schedule an appointment specifically to discuss this list with your doctor or pharmacist. Ask directly, could any of these be contributing to poor circulation or cold extremities? Are there alternative medications without these side effects? Sometimes the answer is switching to a different drug in the same class. Other times, it means weighing the benefits of the medication against the side effects. Maybe your blood pressure is now well controlled and you can reduce the dose or eliminate one medication. Maybe you don't actually need that antihistamine you've been taking for years out of habit. And now we arrive at the #1 cause of cold feet after 60, the one that shocked Harvard Medical School researchers and the one that's almost never diagnosed: autonomic nervous system dysfunction, also called dysautonomia, is the silent epidemic affecting millions of older adults. Your autonomic nervous system controls every automatic function in your body: heart rate, blood pressure, digestion, temperature, regulation, and crucially, the constriction and dilation of blood vessels. This system has two branches: sympathetic, your fight-or-flight response, and parasympathetic, your rest and digest mode. In healthy younger people, these two branches work in perfect balance. When you stand up, your sympathetic system instantly constricts vessels and increases heart rate to maintain blood pressure. When you lie down, your parasympathetic system relaxes everything. When you go outside in the cold, your body automatically reduces blood flow to your extremities to preserve core temperature, but not so much that tissue damage occurs. After 60, this elegant system begins to fail. The nerves controlling your blood vessels lose responsiveness. The feedback loops that sense blood pressure and temperature become sluggish. The result is vessels that don't constrict when they should and don't dilate when they must. Your feet are cold, but you also feel dizzy or lightheaded when you stand up quickly. You have episodes where you feel your heart racing for no reason. You have unexplained digestive issues, constipation alternating with diarrhea. You sweat excessively or barely sweat at all. Your sleep is disrupted, and you never feel rested. You have brain fog and difficulty concentrating. If you recognize yourself in this description, finding a specialist in autonomic disorders could be life-changing. Treatment focuses on supporting the autonomic nervous system through multiple approaches. Increasing fluid and salt intake helps maintain blood volume, making it easier for your system to regulate blood pressure. Compression stockings prevent blood pooling in your legs. Specific exercises, particularly recumbent biking and swimming, improve autonomic tone without triggering orthostatic stress. Medications like midodrine can help constrict vessels when your autonomic system fails to do so. Now that you understand the 7 hidden causes, let us talk about what you can do starting today to improve circulation and warm up those cold feet. Start every morning with 5 minutes of ankle pumps and circles before getting out of bed. This activates the muscle pump in your calves, jump-starting circulation. Sit on the edge of your bed and perform 20 ankle pumps, pointing your toes down, then pulling them up toward your shins. Then make 10 circles in each direction with each foot. Before standing, take 3 deep breaths. This activates your parasympathetic nervous system and prevents the blood pressure drop that causes morning dizziness. Invest in medical-grade compression socks, 15 to 20 mmHg, for general use. Higher if recommended by your doctor. These mechanically assist blood return from your feet, reducing the work your circulatory system must do. Studies show that wearing compression socks reduces symptoms of poor circulation by 47% within 2 weeks. Use contrast hydrotherapy for your feet. Prepare 2 buckets, one with warm water at about 100 degrees Fahrenheit, not hot, and one with cool water at about 60 degrees Fahrenheit. Soak your feet in warm water for 3 minutes, then plunge them into cool water for 1 minute. Repeat this cycle 3 times, always ending with warm. This creates a pumping action that flushes blood through your feet. Studies show this improves circulation for up to 4 hours afterward. The single most effective intervention for cold feet is regular walking. Not leisurely strolling, but purposeful walking, at a pace that slightly elevates your heart rate. Research from the University of Colorado found that adults over 60 who walked briskly for 30 minutes, 5 days per week, increased the density of capillaries in their legs by 23% within 12 weeks. They literally grew new blood vessels. If PAD limits your walking, use the start-stop method. Walk until you feel discomfort, rest until it subsides, then walk again. This actually stimulates even more new vessel growth than continuous walking. Elevate the head of your bed by 6 to 8 inches. This reduces the work your heart must do to pump blood upward, improving overall circulation. But don't elevate your feet. Gravity helps blood reach your feet. So keeping them level or slightly below your heart during sleep is beneficial unless your doctor advises otherwise for a specific condition. Gentlemen and ladies, I want to leave you with this thought. Your cold feet aren't a minor annoyance to accept as part of aging. They're a message from your body, a warning signal that deserves your immediate attention and action. Every moment you ignore this signal, your circulation deteriorates further. Vessels narrow, tissues suffer, risk accumulates.